Well, hi everyone. This video is about neuropathy. Hi, I'm Dr. Brian McGuckin, downtown Frankfurt, and we're going to cover the 3 common causes for neuropathy, and we're going to cover some possible solutions. So what is neuropathy? Neuropathy is when the blood flow to the nerve is shut off or reduced, and the nerve sends signals to the brain that it's in trouble. It's lacking oxygen, it's called hypoxia, and if it goes on long enough, it would die. So the brain picks that signal up as pain. When you're on your elbow watching TV and you get the numbness in your hand, that's lack of blood flow to the nerve. And when you shake it enough, the blood flow comes back and the nerve comes back to life and we're back to normal. But what happens when it's prolonged and we're going into nerve damage? I have tingling, whether it's my hands or my feet. Where we see it most often is the feet, and that's what I'm going to concentrate on. So the main things that we're looking at is trauma to the nerves, which would be standing on concrete, physical impact. Also, as time goes by, especially with standing on concrete or working heavy work jobs, the pad that protects the nerve from impact can thin out. So those are mechanical reasons for neuropathy. There is an internal one where the blood flow in the nerve is actually blocked, artery blockage. That would come from diabetes. Elevated blood sugar damages the arteries, and that leads to arterial blockage. You could also have elevated homocysteine. Homocysteine comes from the breakdown of proteins. If it elevates, if it doesn't leave through the kidneys, it will elevate, and it's a terrible artery irritant, and that's going to cause artery blockage. So that's our job, is to figure out where it's coming from, and then we're looking for possible solutions. What can we do about this? So the feet have pads, going to be in the heel and then in the ball of the foot. The heel, that would be heel spurs, plantar fasciitis, that impact. The ball of the foot, if that's the standing all day, it traumatizes the nerves. So the ligament would be your plantar fasciitis, the nerves. That's going to be the neuropathy. It does not feel good. If it's artery damage, the blood flow is blocked, and there's just not enough oxygen to the nerves, and they tingle, and that's when the people they have a difficult time walking because they can't feel the ground. So what we're after is, what could we do to improve blood flow? What can we do to repair the nerves so they have more blood flow going through the nerves, less traumatized, let them heal? How can we get those nerves to come back? If we can, how can we get them to come back? And what can we do to rebuild the pads and protect them? So at the chiropractic office, we use an instrument, and this has a cadence to it where it thumps. And that breaks up adhesions in the ligament and the musculature, especially from constant impact. Scar tissue build up in there. We have to break it up. So we can massage, and we'll use this instrument to loosen it as well. We will also use exercises and stretches, and what really works quite well are orthotics, and what we're using this for is the padding. This is very, very well made with the impact resistant foams that will protect these pads so they can start to repair. Now they also will have arches in here. The arches are for stability. We don't want to fall during this repair process. We want to be active, and they're supportive so there's no stretching on the ligament and there's no stretching on the nerves. We've got them in different shapes. We've got them in a 3/4 and we've got them in a full length. That way we can adapt to different types of shoes, different types of circumstances. But as a combination between treatment and support and protection, now we can take some stress off the nerves. The next thing is nutritional. What can we do to repair those nerves, and what can we do to rebuild the collagen fibers to rebuild those pads? And that's individual based on what we find with our consultation and find with laboratory testing. On the artery blockage, this takes time. But what can we do to repair the arteries? Do they have a blood sugar problem? We can help them with diet. Is there stress involved causing the blood sugar? We can help them with physical activity. What can we do? We use a green light relaxation treatment to help keep cortisol levels in line where they should be, and diet and nutritional support to keep the blood sugar in balance, and we do that in conjunction with their endocrinologist. If there's elevated homocysteine, we see that on a blood test. That's nutritional. It's what they're eating. We want to increase their green vegetables, and then we treat with B vitamins to lower the homocysteine. But we're actively, nutritionally, what can we do to repair those arteries? And then we have our proof. How does it feel? So 6 months into this, where is that person at with relief? That's what we're actively looking for, is a steady improvement. So it's a nutritional solution, it's physical, we're protecting, and there's some treatment to it. So we're trying to get as complete of a whole person repair as possible. That's our goal, that's what our solutions are up to. So that's neuropathy. Hope this is helpful. Keep watching other videos. Leave a message, let me know if this is helpful. Thanks for watching.